Hello beautiful mummies and babies. I welcome you all to Hirkani Gynecology and Breastfeeding Medicine Clinic. So mummies, we are going to talk about mother's milk supply. Is my milk is enough for baby? This is the concern that many mothers have, and this concern causes mother to give the baby the supplementary feeding. Now, what happens when the mother breastfeeds the baby, the milk is not seen, how much milk is gone to the baby. For example, if the baby gets the formula in the bottle, it is seen ki so much 80 ml, 90 ml the baby has taken. Another thing, after few weeks, the breast becomes softer, and that also mother takes as if her milk supply has gone down. Sometimes the baby cries again and again and asking for milk, and that also mother takes it wrongly as if her milk supply has gone down. So how mother will know that my milk is enough for baby? Now if you see the baby who gets enough milk, it generally looks happy, contented, and sleeps in between the feeding. But there are three parameters. The first thing is the baby's urine output. After 6 days after delivery, the baby will pass generally the urine at least 6 to 7 times per day or in 24 hours. So the nappy will be weighed 6 to 7 times. And the second thing is the baby's weight gain. Now if the milk is enough, the baby will put on generally 25 to 30 grams per day in the beginning, in the initial 6 months, and at least 600 grams per month the baby should gain weight. In the initially after the delivery, the baby's weight goes down, baby loses some weight, 7 to 8% up to 5th to 6th day, and then baby starts gaining weight. So at least by day 10 to 14, the baby's birth weight comes back to normal, and then baby starts gaining weight. So by the time the baby is 5 months old, the baby's weight is double, and when the baby is 1 year old, the baby's weight becomes triple. Now suppose really the milk supply is less, for example the baby is not gaining the weight, so what to do? The first thing is the attachment. We have to check whether the baby is latched properly at the breast. Is there effective milk transfer from mother to baby? So we in another video we have shown in detail how should be the baby's attachment. The second thing is the breast compression. So whenever the baby is at the breast, so what mother can do? So if you see the breast and the baby is latched, so what she can do? She can just compress the breast. So what happens? From the milk glands, the milk flows to the ducts and to the baby. So baby will start sucking again. So when the baby stops after some time, again she can compress other area. So like that she can go on 360 degrees, and that way the maximum the breast will be emptied and the baby will get the milk. The frequency of the breastfeeding is very important, at least 8 to 10 times in 24 hours, because the frequent milk removal will increase the mother's milk supply. So sometimes the baby may ask after 2 hours, 3 hours, or even sometimes even after half an hour. But that is natural and normal for the breastfeeding. The breastfeeding has no any discipline. So whenever the baby wants, the mother should breastfeed. Now the next question the mother will ask, how do I know my baby is hungry? Because many mothers, they think wrongly that when the baby cries, baby is hungry. But the baby crying is actually the last cue. And when the baby cries, that means the baby may be very irritable because baby is too hungry, and then baby may not latch properly. So what we have to do is see for the early cues. So when the baby is sleeping and wakes up, opens the eyes, looks around here and there, or starts opening the mouth, they have this routine reflex. So they are doing ah and looking for the breast, or sometimes then they put the fingers in the mouth, or they make some sound in the mouth. So these are the stages when the mother should put the baby at the breast. So baby will take nicely the breastfeed, and it will help to increase the milk supply as well. The skin to skin contact is again important thing. The mother always should wear the front open clothes, so that the baby and the mother are direct in touch with each other. That will help for mother to know also when the baby is hungry, and it will encourage baby also to take the breastfeed. And another important thing is avoiding supplementary feeding. What happens, suppose the mother is tired and she wants to sleep for a longer time, and if the supplementary feed is given that time, then the baby becomes full, and then baby may not be eager to take the breastfeed. If suppose the bottle is given to the baby, what happens with the bottle? The texture of that nipple is different, and then the baby gets passively lots of milk, and that may not be case at the breast. So baby may likely that refuse the breast later on. So avoiding the supplementary feeding, particularly with the bottle, is important. Then when the mother comes to us with the less milk supply, we also give certain medicines along with all these measures. We also advise certain pumps, so that if the baby is refusing at the breast, so how the mother removes the milk? Because the frequent removal of the milk and the stimulation of the breast is important to increase the mother's milk supply. So there are nice hospital graded electric pumps which are important, or even she can express the milk manually. So if she removes that particularly the milk, then her milk supply will increase. So remember, all women can produce enough amount of milk for the baby. So again, the World Health Organization and UNICEF has recommended exclusive breastfeeding for first 6 months of baby's life, and continue breastfeeding at least till 2 years of age.